I meant to shave. But as you know, it's day 9,453 of hanging out in the basement. But I did do something today in 1912. Well, not today, next Monday in 1912, the Detroit Tigers debuted Tiger Stadium. And so I've got my, we were writing next Monday's script, so I had to wear my Tiger jersey and my Mr. Rogers sweater. So I did do that for you. You're welcome. Hey guys, we've got a great hangout today. My friend Scott Heiser, who's on the show in December, is going to join us and talk healthcare. And what I love about talking to Scott is we can have this conversation that normally is kind of emotionally charged, I would say. And but we can have this conversation without having the political conversation, because frankly, I don't really have time for the political conversation. Don't get me wrong, like everybody else, I have an opinion, but I think that if we deal with, and you've heard me talk about this stuff before, Stephen Covey's 7 Habits of Highly Effective People, we're going to do much better. Which there's three pots. If we talk about Stephen Covey, pot 1 is things that you can control. And pot 2 are things that you can control and can influence. And then pot 3 are things that you can neither control nor influence. Most people, when it comes to healthcare, spend most of their time talking about pot 3 stuff. We're not going to talk about pot 3 stuff. Yeah, you can go vote about what you think about pot 3 healthcare stuff. And we have, but because we anticipate some people may decide to have that discussion anyway, our room mom, Gertrude, is joining us, and she'll just politely remind people that we're not having that discussion. We're going to talk about stuff that you can either control and influence. And when Scott was with us back in December, he talked about a lot of stuff that really I found fascinating. Ways that you can help lower the cost of healthcare. We all complain about the cost of healthcare. How can you personally lower the cost of healthcare? I thought that was fantastic. And then second, when you look at coverages. So the difference between coverage, and I'm sure we'll talk about this again today, the difference between covering the cost of healthcare and actually making healthcare itself. So there's healthcare coverage, right? Your insurance policy. And then there's the actual healthcare itself, and really two different things. So we're going to get into that. Hey, Chris, happy tax day to you, my friend. Isn't it weird? A year ago, this was tax day. Remember, we were all young and naive, and this was tax day. That was fantastic. So we are going to get things rolling here. And Gertrude, you know what you might want to do is you might want to send a quick stacker email to everybody just to remind them that we're live, because we told everybody yesterday and instead of today. But while we're hanging out, let's get the man himself up here, all the way from Northern Michigan. Just found out he's in Northern Michigan. My friend Scott Heiser. How are you, man?
Great, Joel. Thanks for having me back.
Well, you dressed up for me and I couldn't be bothered. So
and you got me to shave and wear a shirt today. So and I just want to tell everybody else that might be listening, it has snowed. We have a couple of inches of snow on the ground. So that is another we'll talk about probably mental stress today. That's been another added one to our lives up here when we're looking for sunshine and getting the ski boots out again.
Snow in April, only in Michigan. Yeah.
Only in Northern Michigan.
Yeah, that's funny. My friend Andy Hill, who's a podcaster, he has a great podcast called Marriage, Kids, and Money, lives a couple streets away. We always have board game nights together, cookouts with the families. He's in Marquette, dude.
Oh, yeah. Yeah, far worse than where we are. Not that Marquette's a great place, but I mean weather-wise.
Yeah. No, he got 2 feet of snow. It was absolutely crazy. You already have a fan here. Katie's hanging out with us. Hey, Katie, says your book looks awesome. I can't wait to read it.
Great. Thank you, Katie.
I have to tell you, Scott's book was great. So, and Scott's heard the story before, but many of you haven't. Since we're just hanging out here, I'll tell you this story. So I already did my rant about not talking politics, and we have a team of 6 people that put together the Stacking Benjamin show. We work on a 5-week schedule. And when Scott's name came across our desk, usually it's pretty unanimous. You know, maybe it's 5-1 or 4-2, but it's not a split decision. It's usually, yeah, we're doing it. No, we're not doing it. And man, when Scott's name came across our desk in this fantastic book, Healthcare is Making Me Sick, we had a fight, man. I know, I think I told you this, Scott. We had a fight about whether to even address it. We're like, no, don't want to go in there. And then as we read the book, seeing that there were, politics are not in the book. This is all stuff that you can do yourself. So I don't know, maybe we start there. Start off with the difference. A lot of people, when they talk about healthcare and health coverage, they get those confused.
Yeah, then it is the quintessential problem we've got in the U.S. right now, and I won't bore you with why we are where we are. But healthcare, taking care of yourself and your health, and going to providers that will help you do that, and other means, diet, so on and so forth, is one whole area. The second one is then how you pay for it, and that's in health insurance. And we've allowed our society, the way we've delivered it, is to conflate the two, so everybody thinks health insurance is health care. It is solely a means to pay for health care. That's it. And I got into this really for all the reasons you're talking about. Is I did the corporate world for years and helped corporations save money and develop their programs and price it. And really just saw, if we wanted to really grab this healthcare costs and access and all the issues with it by the neck and try to get a hold of it and try to get, like you said, Covey says, get control and influence. I got to go to you and me, the average guys on the street, because that's who's going to make a difference. Corporations have their own objectives, and that's what they're supposed to do. And it's not really delivering healthcare. They do it because they need to be competitive. So you need to get each individual to become possessive about their own healthcare and understand it more, and actually become a consumer. And that's where we start talking about, if you become a consumer and you start getting information that's now becoming available, and you shop and understand who you are and what your goals are and look for things that solve your own goals, you will have better outcomes. And whether you reduce the cost or not is not necessarily the situation, because if you get a better outcome and you spent the same amount of money, but you got a better outcome, that's an enhancement.
Sure.
But I can also suggest that you can lower those costs too. It's not a miracle, but if we're going to change things, we need to control what we can control, then influence what can be influenced, and start there. And if each one of us do that just a little bit, a wee bit, then we're going to impact the larger situation.
You had a great analogy about razors, and I love how you compared healthcare to razors. Do you mind doing that for us again?
Sure. And preface it by saying we're not doing this in healthcare, and we need to be doing it.
Yeah,
but there's a company, or there's a number of companies out there, big national Fortune 100, Fortune 50 companies that make razors, and they're excellent razors. They're high technology, and I haven't nicked myself in years using them. They also cost close to $5 a blade, and you start looking at it and saying, I might grow a beard instead of shaving. But what that did, it opened up, is competition. And there was the dollar shave. There's a number of different companies that came out with an alternative, that the technology wasn't quite as good, but in a comparative basis, for $1 versus $5, it passed the grade. And so they became an overnight sensation, and they did it all online and delivered it via whatever delivery system they used, and could have been a number. They put a dent in this Fortune 50 company. And what does an elastic market do when it finds it has competition? It changes, and that company reduced its cost 20-25% to become competitive again. So now we have more options instead of less. And that's the problem with healthcare, is we don't get involved, and we don't understand, and we don't shop. And so the people that are there are meeting their own objectives, meaning hospitals, providers, insurance companies, government, and they're there just talking about their own objectives, and they're meeting them. And there's nothing inherently wrong with that. What's missing is our objectives being at the table, so that we can influence them like we can influence shaving blades or a phone or a pair of gym shoes. We spend more time researching on those items than we do on our own health. And the greatest asset you've ever been given, or ever will be given in your life, is your life. And we don't spend any time on it.
This was so fascinating to me, Scott, because, and I don't even know if we talked about it or just the ahas that I had. Like, as an example, so many people go to you're seeing these urgent care clinics show up all over the place. And don't get me wrong, I'm sure good doctors, good at what they do, but they don't know you. They don't have any of your records. So we talk about driving up the cost of healthcare. We go to the doc in a box. They have to run a bunch of tests to figure out who we are. They don't have any history. They don't know that this might have been an old wound that I had from something or other. They have to, and all of a sudden, just because of the fact that I decided to do what was, quote, the easy thing, instead of doing what you're talking about, shopping and using the people who are usually in my corner, I'm driving the cost up on myself.
Well, there's two sides to that. I definitely see the point you're making. And the biggest point is, once you understand who you are from a health perspective, your own health profile, you can determine your own objectives, what your own costs may be based on past history, family history, your claims from the previous year. Then now you can pick a doctor and get a relationship so they understand you based on the illnesses you have. And then you want to drive that. You want to, that is going to be your coach through the whole system.
Yeah.
And it's usually a primary care physician, and they're going to help you maximize your outcomes. And hopefully, if you dialogue with them, minimize your costs. And that's something you have to work with. The whole urgent care ER system, urgent care emergency, telemedicine we're going to talk about, are ways to, when your primary care physician is not available, to hours potentially. Let's say you're working third shift at your employer, everything's closed. How do you get care? So they provide an alternative to that. And the urgent care came about because most people were going to the emergency room, and the emergency room is thousands of dollars every time you walk through the door. I exaggerate a little bit, but not too far off. Yeah. And so the urgent care is a 24-hour primary care physician. They don't have all your records, so that's a disadvantage, but it's better than going to the emergency room.
But that's also a great point that you're making, is that they exist for a reason. There's a reason to use them. My point, I guess, was people using them for the wrong reason, just going, I'm just going to do this thing, which I thought was ridiculous. But there was something else that you touched on a little bit, which is nobody shops their doctor. Like you don't shop. You and I had a great discussion, Scott, about medical tourism, right? People going to Canada or going to Mexico or Guatemala or wherever to get a procedure done. You said you don't even have to do that. You can go across town. You never ask, what is this going to cost? People never ask. If you have insurance, you don't ask what it costs.
Well, not only do we not ask when we have insurance, a lot of the physicians' offices, when you ask, say, you don't need to worry about that. You have insurance.
Right.
And that just defeats the whole purpose of understanding what your situation is. Now, with the advent of the increased costs of healthcare and with ACA, aka Obamacare, the deductibles and coinsurance that we have to pay has increased dramatically. And that has caused people to say, I have insurance, but I might have to pay $5,000 out of my pocket before my insurance kicks in. So I want to know how I'm spending my $5,000. And that's been, I think, if you're going to make lemonade out of lemons, no one wants a $5,000 deductible and have it so expensive. But because that's there, people are starting to say, hey, wait a minute. What is that? I know I have insurance, but please tell me what cost. And what I always suggest is, if you go to your doctor, say, doc, the first $5's on me. You got to help me out. Let's find the most effective course of treatment for both of us. And if I'm paying for it, can you help me? And most physicians are all in on that. And they may not have all the ins and outs how to do it, but they're very sensitive to it. And the suggestion I have is if you're searching for a doctor and you pick one based on your illnesses or your conditions and what you may need, and they're not sensitive to that next issue, that financial issue, that may not be the right doctor for you. Now, and I would like to preface as we get deep into doctors, nurses, all medical care, all first providers right now are providing Herculean efforts. They are going right into the storm with very minimal protections, and they're doing a fabulous job. And the whole book is not about us versus them. It's really forming partnerships with people, but coming in informed about who we are. We have a responsibility to know who we are and what we want, and explain that effectively and efficiently with our providers so that they can provide better service to us. It'd be the equivalent of going into a garage mechanic with your car and saying, it rattles sometimes, fix it, I'll be back in 3 hours.
Right.
I mean, they're going to run every test. They're going to do everything. They have no idea what to do.
Yeah.
Doctors no different. So we have a responsibility that's incumbent upon us to help them help us. And if you do that and you form that partnership and you do a little research and you write down what your needs are, so you respect their time when you go in, you have better outcomes. They can give you better diagnosis. That's how ultimately you save money, save time, and you're healthier.
Well, and something I love that you say is that, you have this high price, imagine you have this high price consultant in your corner, and then you go in the room with them, you got 10 minutes and you spend the entire time babbling about nothing. That's really what you have with your doctor. Don't go in there babbling about nothing. If they're a high price consultant, they can help you with a ton of stuff, but treat them like a high price consultant. It's going to come out better.
Yeah. Average primary care physician has 8 minutes to see you.
Yeah. Yeah.
You've got to be pretty succinct if you got 8 minutes.
You really do. I mean, be prepared for that. Katie hanging out with us says that she shopped her OBGYN for the birth of her child, but then she said, but it wasn't easy. You know,
I agree.
It is not easy. I think it gets easier though, Katie, and tell me if you agree with this, Scott, if we all start asking what's the price. I mean, my feeling is the reason why hospitals don't have the price, Scott, partly is because nobody asks, right? If we all start asking what's the price of this, we'll start seeing price lists.
But it's twofold. It can be very complex, and there can be complications once you go in. You go in for X, and there are complications upon it. You develop a fever, you develop an infection. So to quote a price, it changes, and that's hard to explain to people. But that's not a reason not to do it. It's what you have to explain to people is that this is a range of what it could cost based for standard care for that situation, and that people need to understand that so they can start making decisions. But it's also not just about price; it's about outcome. So some of the transparency sites out there now are showing you physicians, doctors, hospitals, the volume they do of a certain procedure, and volume is king. Usually, if someone's doing a lot of something, they get better at it. And it's just simple math.
Sure.
So if they're doing a lot of it, that they're getting better at, they get practiced. That's who you want to see. So in Katie's situation, she may have found an OBGYN that fits her needs more and treats people like her situation more often. She's going to have a better relationship with that. So then that's primary. And then secondary, you got to ask about what costs. Are you a fair cost? And the medical tourism is you can find in any city, any state, for the same care, different costs. And if you ask about that, you would that for a gallon of milk, an Apple iPhone, you would do that. Yeah. So it's not offensive if you do it diplomatically. And I've gone to a number of vets, and I always tell a vet after they go through everything, I said, I wish you were my primary care physician. Because and one of the things about it is there really isn't a lot of pet insurance, health insurance.
Right.
So everybody has to pay for it. So it's just discussed. They walk through all the course of treatments. They explain what it could be. Here's what the cost be. And my jaw always drops and goes, that was beautiful. And most vets will tell you, well, two things. Our patients can't talk back to us and they're not paying the bills. So they enjoy it. It's easier to do. But if I can segue back on the calling the doctors in the ER and the UR with
please.
Telemedicine is one of the big areas that's exploded with COVID-19 for the reasons of the social distancing and not wanting to go. Hard to get because the overloaded medical system. Become very apparent that it's a solution of the future. And with telemedicine, we just want to make one offer on our website, uncoveredhc.com. We do have a telemedicine service available, and for your viewers, we'll be offering a 1 free month to anybody that goes on and looks at it. If it makes sense for you, just write free month, all one word, in the coupon section, and that'll get a free month of it for you. But what's important about telemedicine right now is it doesn't overburden the medical system. It allows you to comply with being 6 feet or social distancing, not going into an environment where there are sick people, and there should be sick people. And then it just gives you convenience that you can go 24/7 and get a hold of a board certified primary care physician to discuss your situations. And the neat thing about telemedicine these days is they're prescribing medicines to you. They'll call your pharmacy. You'll have to look in your own health insurance plan. See if you have telemedicine. If you've got it, use it. If you don't, there are other programs you might be able to purchase on your own out there. They're worthwhile. If a normal office visit from a primary care physician is around $120, if you get it through your insurance plan, it can be $80, and sometimes through telemedicine programs they can be $50 or $40. I'll say a lot of the insurance companies now are waiving those costs if you have it within your plan. So it's a good thing to look at and maybe take advantage now.
Let's get to some questions. We had a couple questions from people ahead of time. And by the way, before we get to this question, which is from Adrian, who sent it to me ahead, I think she's going to watch the video later. Katie asked a question here, and I don't know. We've gotten so far ahead. She said, Scott, what is your suggestion to how to bring that conversation up with the doc? Because I find they hate having that conversation. I don't remember. We've had so many conversations already, Scott. I'm not sure which one what discussion Katie's talking about. So if she wants to define that, I
think she's talking about how do you bring up asking them what it costs.
Oh, the cost discussion.
Yeah, Katie, if that's right. And it can be a tough question. And a lot of times you'll get the defense that, a lot of practice will say, I don't deal with that, deal with my administrator. Let's see, Scott, what is your suggestion on how to bring the conversation up? Yeah. So they'll say, you got to talk to my administrator, and you'll have to work each situation out. And maybe that's what you do. And you talk to the administrator about what the costs are and not with a doctor. But I find what's worked for me, and you have to find what works for you, is when you make it, you want to be when you're talking to your physician, very organized and non-emotional. But when you get to the finances, you want to say, I'm paying for this. This is my dollar. It's not insurance. So I need to stretch my dollar as far as it can go and get the best outcome. I need you to partner with me, if you will, and approach it like that and see how they respond. If they send you the administrator, say the same thing. I give you a quick story. I had an MRI personally where they was going into a orthopedic gentleman, a doctor, and they said you need an MRI. They had their own MRI facility there. I went out to schedule and I asked what they cost, and they wouldn't tell me. So I said I knew actually through a couple different sources that there were other MRI sites in town, freestanding MRI sites, and said I'll go check it out. And I didn't check it out immediately. Well, that nurse called me back within a week, and called and said, have you found something out? And I had gotten one. And then when she realized my business might be going somewhere else, she gave me one that was even cheaper than one that I had.
Wow.
So sometimes it doesn't happen instantaneously, but if you stay the course and keep asking, and you do it diplomatically, and you just say that it is your money, you have to spend it, and you want to spend it wisely, they will work with you. It's the same thing for like getting a second opinion. If it's going to be a big procedure, like delivering a child, you should be getting second opinions with who you're going to be your OBGYN. And if they have an issue with that, maybe they're not the right doctor.
What's that joke about? I don't, this is an old comedian, like in the 50s, the one about the family having the kid, and they said they want a second opinion. The doctor said, okay, your kid's ugly. Like it was, I don't remember the whole joke, but I don't think you need the whole joke.
To get what he's saying. Yeah.
Adrian asks, and we've got over 7 million people over the last 2 weeks, Scott, who have lost their jobs, right? So they've lost their access to healthcare, maybe. So Adrian asked, can you discuss COBRA? And will it differ much from your former employer's normal coverage if you're using the same plan? Because a lot of people right now, I think, with 7 million people losing their jobs, you better believe there's a lot of people out there looking at COBRA right now. Yeah,
tough times. And that's a great question to ask right now. So you're employed with your employer. And if you were terminated as a result of this COVID situation, you are going to be offered COBRA if your employer has 20 or more employees. If they have less, they don't legally have to offer COBRA. If you're offered COBRA, you will be offered through your employer the exact plan you're on now. So there will be no difference in plans. You'll stay on your employer's plan, as an employee, former employee, you'll have 18 months. You can stay on that. There's other qualifiers for dependents and things that can get up to 36, but for this conversation's sake, you can get 18 months. The one issue you'll find very quickly, though, is most employers pay about 75 to 80% of the monthly premium of that plan you had. So the cost you see, you're going to say, why did it go up so much? Because your contribution represented only 25% of that cost. So you'll see that go up. If you're totally comfortable with that and with your plan, because you could be in a course of treatment and your doctors are in it, and that makes sense to stay with it, and you can handle that cost differential, then that's fine. If you can't, from a cost standpoint, what everybody that's lost a job had happened to them as a qualifying life event. And that's the technical term that allows people who have a qualifying life event to be eligible for either COBRA or to go back into the healthcare insurance system and receive healthcare insurance. So that would be another option. And you may be able to get subsidies now because you don't have a job through the healthcare.gov or the ACA plans, and or may even be qualified for Medicaid, which is generally very, very low premium price or free, depending on the state you're in. And the only issue you would have, so that's it for an employer side. If you did not have insurance prior to losing your job, or you just didn't have insurance, most of the healthcare.gov programs are not offering you to get insurance now. There are some states, and if you don't mind, I'll read them to you quickly. California, Colorado, Connecticut, DC, Massachusetts, Maryland, Nevada, New York, and Rhode Island have opened special enrollment periods. If you live in those states, you can, if you did not have insurance, you can maybe look at it to enroll now. If you aren't in one of those states and you were uninsured, I believe the federal government they're not going to allow you to enroll in healthcare insurance right now, but what they will allow you to do, or what is going to happen, is they were going to be covering uninsured individuals' COVID-19 related healthcare costs.
Oh, gotcha.
And that's probably going to be paid for out of the CARES Act, the $2.2 trillion CARES Act, under the provision of $150 billion going to hospitals. So they know the hospitals will be treating people for COVID-19, and it makes all the sense to do that. So even if you don't have insurance and you go in, the hospitals are probably going to be reimbursed by the federal government for that.
Yeah, so Ryan here in the comments. Ryan, you're saying the same thing Scott's saying as he's saying it. Ryan is echoing that. But I like the way that the stackers talk about this. Remember how when you were talking about how easy the vet makes it, Scott?
Yeah,
that makes everything easy. Well, Sam said he went to the vet for his vasectomy. Knew exactly what he was paying. They do vasectomies all day.
And I guess I could ask Sam, all right, were you wagging your tail when you left, or was it tucked between your leg?
That's right. And then Bill replied that yes, but he had to wear a comb for a week. So
the cone of shame. Yeah. Now it's interesting is my wife makes me wear that around the house, even if I haven't had a vasectomy. We don't want to go into those details.
That's a whole different show.
That's right.
That comes back next time. But when it comes to this period specifically, we talk about, or you talked about, a lot of the COVID related costs being picked up. What about health insurance companies? We saw Humana, right? I mean, Humana was all over the place saying that they were waiving COVID related stuff. Have most other health insurance companies done the same, or not?
It's a range. And so I'm going to give you a quick tip, and it's going to be long, but this is a great place to go to find out pretty much every health insurer in the country. And you want to look up ahip.org/health-insurance-providers-response-to-COVID-19 /.
Give me that one more time, and I'm gonna write it and put it on the screen for everybody.
Okay. And as a note, if you go to the uncoveredhc.com website,
yes,
we've got a whole site that talks about how to go through if you've lost your insurance. And this is listed in there for you to check out what insurance carriers are paying. But it is AHIP, that's ahip.org/health-insurance-providers-response-to-coronavirus-COVID-19 /.
Yeah.
What that does, and it's a blog, so it's kept up daily. It'll give you what the insurance company that you're with is how they're handling insured coverage for individual coverage and probably employer-sponsored insured coverage. And I will go back and address that in a second, the differences. But you have some companies like Aetna and Humana who are, well, let me talk in generalities.
Yeah.
Most of the insurance companies now, if you have an insured policy, not as an employer's and self-insured policy, but an insured policy, are covering telemedicine at no cost to membership cost. They're covering testing at no membership cost for COVID. Some are covering no membership cost for any COVID, and that's Aetna and Humana.
Wow.
Most aren't doing that, but some do. So go on this site, and it's actually an insurance industry's insider site. It's a organization for health insurers. So you're kind of getting inside information, and that's the whole part of my book, is to give you inside information how to get better control of your healthcare. It's a great resource to look at, and you can look up your own specific plan, and it's got A to Z, all the at least most of the carriers that I know out there.
Great question.
Quick, if I can digress on it. So I did mention self-insured. Okay, so if you're working for an employer who self-insures the health plan you have, you may think you have insurance. You do have insurance, but it's self-insured by your employer. Well, each employer, self-insured employer health plan, the employer is going to make their own decisions about all the features I just went through. So whether it's free telemedicine or free COVID testing, they make their own decisions. I'll say most self-insured employers are including those services at no membership cost for telemedicine and for COVID testing. Most of them for COVID-related claims are going to treat it like any other illness. So if you have a deductible, co-insurance, co-pays, and you go in beyond a COVID test or telemedicine, you will be treated like any other illness that you had. But what you want to do is ask your employer. If you've lost your job and you're going to go on COBRA, ask your employer. They're going to send you a packet. So from your termination date, they send you a packet. You have 60 days to pay that premium and be retroactively reinstated before they can cancel you and not let you back on. My advice would be is if you get it and you need it, do it quickly and don't let the date slip.
Yeah, right. Sam had a question. Scott, getting back to, we were talking about comparing prices, and this was interesting. If you can get a price, how do you compare? I've gotten costs beforehand, but have nothing to compare it to. Are the costs varied enough that it's worth all the time to shop around? You and I talked about some new, insurtech companies that are kind of working on this problem, making it easier for you to comparison shop.
Yeah, and again, on our website, we've got a reference section that goes through transparency sites that can help you. Guru is one of them that gives you general costs across the country, and we'll compare different areas. Now, they're going to be more of an average cost, so you can then go into your doctor and compare, are they average, below, above, so on and so forth. There's one called Amino Health out of California.
We talked to them on our Friday FinTech show
right.
about a year and a half ago. Yeah, fantastic.
Great company. They'll give you two things. They'll give you the volume the docs are doing that you're looking up. And remember, earlier I said volume's king. So you'll see if the doctor's in the 95th, 90th percentile of people performing that specific procedure or surgery, so on and so forth. That gives you an idea how many they're doing. They also talk about what the costs are. So that's a great site to do, and we've got that website, Amino Health. If you look that up, Amino Health, I think /doc costs. We'll get you in there. So then you start to get comparisons on that, and you're 100% right. How can I be a shopper if I don't get multiple prices and multiple outcomes? The beauty of technology is the egg has been cracked, and we've got Silicon Valley dying to get into 1/6 of the economy. And that's a great thing for all of us as consumers. There's not a bad thing about that. What I can say, though, is a lot of people are going to go in and out, whether they make it, they may not, because they've got to drive enough revenue to survive. But it's out there. And I've given you a couple that just mentioned that we've researched and looked into that are valid and have been around. The other one is go to your carrier. If you have insurance, go to your carrier, and they'll list out the doctors and the costs almost every major carrier is doing that now, and they'll help direct you. I would suggest, though, as you start scrolling through the docs, they'll pop up the doc if you put a procedure in. It's not necessarily intuitive that you're going to get the best costing doctor and the best outcome doctor first. Scroll the whole list, and it does take some more time. But I had an individual with an MRI to look at one, and the first ones they got were $3,500, and when they scrolled to the bottom, they found some for $350.
Wow.
$350, $3,500. Now,
and it wasn't a vet.
No, I don't think so. I don't think no. No, it was not a vet. It was not a vet. But they did have to do, back to the medical tourism, they drove an hour and a half.
Sure.
But they saved 10 times.
Yeah.
Now that, to me, that paid for the gas tank on the hour and a half drive. So those can happen. You got to dig, and you got to keep digging. Try a couple of those sites out. You know what? We're always interested in our site too, is if people find another transparency site, and I've got 3 or 4, actually 4 or 5 listed. We'd love to hear from you. We'll do some due diligence on it. That's what we spent our career doing, due diligence on these type companies to validate them. But we don't have all the answers. What we want to do is motivate you to do this, and create the revolution on how to reduce healthcare costs.
I want to talk about a different type of healthcare for a minute, Scott, which is mental health. Of course, now people, living a whole different life the last month. I've heard studies on people living alone, having difficulties. I have other friends, by the way, that live alone, love it, think it's the best thing ever. Right? So it more depends on who you are. And other people have a family. They love being with their family. Other people are realizing they don't like each other that much. The whole mental health thing and COVID, what's changing there now?
Well, that's changing as we speak, and we really don't know the outcomes of it, except to say when you change your life dramatically and you can't do the things you loved and what give you purpose, we know there's going to be stress and anxiety. You also know the stress, anxiety exacerbate illness. So knowing that, it's incumbent upon us and imperative for us to find ways to manage that. New York City has dropped a hotline because they're probably the most quarantined city in the country. Maybe Detroit too, and I'll look up and maybe get back to you on that on Detroit. But New Yorkers have a hotline of 844-863-9314, and you can call that number and get a qualified mental professional to assist you with whatever issues you've got at this point in time. You also want to look at some of your telemedicine programs. They may have a concierge service that offers healthcare counseling. If your employer offers an EAP program or an employee's assistant program, look that up. There'll usually be 3 counseling sessions in there that you can get and at least get started, and then they'll give you references what to do after that. But you definitely want to be addressing that. Your mental health. And so there's number of ways to do that. We're on our site going to be launching for the first time tomorrow a program called Thriving with Stress. And during the COVID outbreak, for the extended period of time right now, it's going to be a free service, and it's a session or 4 sessions that will complete the course on how to thrive with stress. But go to if you're religious, contact your pastors, rabbis, imams, and find support groups. And if you don't have any of those, find a support group. Get on a chat group and talk about people. So much of the human condition in staying healthy is having a sense of purpose and a sense of community. Everybody talks about your diet and exercise and all that, but when you boil down, it's a sense of purpose. Why do you exist? Why are you getting up? Why are you doing what you do? And do you feel like you have a reason to do that? And then the sense of community. Most humans are not stoic individuals living in caves. They need, and we're pack animals. We need to be with everybody, and we thrive off of that. So find your own network and share your issues with them.
And then last, in terms of, we talked about a number of changes because of the crisis here. Any other changes in healthcare that we've failed to discuss?
Healthcare in general, right? It really, my book needs to be put on hold a little bit right now because of the way the world is. And the telemedicine is big as a way to help yourself stay connected with that. Most physician practices now have all gone to telemedicine. So call your doctor, use them. You don't need to have a separate telemedicine program. They may be offering telemedicine on their own to do that. So I'd say that's the biggest way. And then following the CDC, simple guidelines. They're just not complicated, and they're common sense, and they work. From staying 6 feet apart. If you're sick, well, we can't go to the office now anyway, but don't go out in crowds. Don't see other people. If you're sick, stay home.
Well, I think that tip's more important when the economy finally opens up, right? I mean,
right.
you're gonna have some moron that goes, "Oh, it's just a little fever, so I'm going into the office today."
Yeah, there'll certainly be a period of time, maybe 24 months, where just going in because you have a little fever, you have sniffles, employers and employees are going to manage that differently. The one thing we've all gone virtual and we're all at home, so that should be easier to do, and employers should be more accepting of that than maybe in the past.
Yeah, definitely. Bill, with a good point, saying you hear the person who works full time in their 80s or 90s, they pass away a few days after they retire. That actually, Bill, is not as frustrating for me as when I see somebody that retires early, right? They retire at 55 and then all of a sudden start having aches and pains and health problems because their whole, all they thought about was getting away from work, not what they were going to. And they were so excited thinking that life was going to change, and you still show up, right? It's crazy. Yeah.
You shouldn't run from things. You should run to things.
Yeah. Good stuff. Scott and I are hanging out for a couple more minutes. And while I give Scott a chance to catch his breath here, because we've had him on just going crazy. I want to tell you about Friday, where Scott's helping us with healthcare. Our friend, Dr. Daniel Crosby, going to help us with your investing. And what I love about Dr. Crosby, and he's number one, like Scott, he's very funny and engaging, but he had a TEDx video that went very viral. You can look it up. I believe the name of the video is called "You're Not That Special." And basically what it says is it's those times when we think that we're different than everybody else that we manage to mess up our money. When we quit playing the statistics. And so he works on behavior and investor behavior and has some phenomenal statistics. And I see people every day during this online trying to blow up their plan, and don't blow up your plan. So if you're feeling like you might, hang out with us on Friday, or if you just want to hang out with us again on Friday. Good stuff. Katie's got another question, I think, maybe for you here.
Yeah, a couple good questions about medical bills and staying organized.
Yeah, let's start.
So one, if Katie, you have health insurance, and one thing you need to always be careful is doctor offices have somewhat automated billing systems, and they're going to send you bills all the time. If you've got a health plan, health insurance coverage, you want to look at your explanation of benefit, and you want to, that's the primary source. That's going to tell you how your plan is working, what it's paying for, what it's not paying for, and it'll tell you what you need to pay. You need to, I don't want to say disregard, but it can get the direct bills from the doctor or the hospital will be confusing. Stay with the healthcare carrier. I'd also say we're all paying a lot of money to health insurance companies. So if your bill's confusing, and unfortunately, a lot of explanation of benefits were either created in a vacuum or created in preschool. I don't know, but they're not intuitive. They're not easy to read. But here's the other point. If we're all paying a ton of money for that. Get on the phone. A lot of services you have will have a concierge service through your healthcare carrier. Call them and say, "Help me through the bill. Let's go through and understand what this is." And that way, everybody has organizing your bills they're all going to flow through. They can lag, and sometimes, unfortunately, the larger the bill, like a hospital bills, sometimes they'll hold them because they'll do audits on the bills and they come later, and they can become very confusing. But my biggest suggestion on that is to call the concierge service with the carrier and make them explain it to you. And then if you don't understand it, then there's actually some, we've got references, points to those. Some billing companies will help you. I'd only suggest that if you are debating the bill, and they can help you potentially reduce that bill. There's a cost usually associated with a percentage of what they save. But that would kind of be last resort. I think what you're just talking about is I'm getting bills in all the time. Wait to the end of the month, wait to the cycle, and then grab them all and look at them at that time and call the concierge service.
Katie, on the financial planning part of this, which is because they're coming so late afterwards, this for me is two things. Number one, following Scott's direction on trying to find out about how much it's going to cost, even though the bill might come much later, trying to get a beat on that as quickly as possible makes sense. But also this is where your emergency fund comes in, and making sure you keep, a significant emergency fund, because if you had something a year ago and you're being billed, or significant time later and you're being billed and you owe the bill, you don't want to go into credit card debt. Most of the time, by the way, when I saw, and it's not even just me, let's go to, I believe, a survey by Capital One. Most of the time when people had to declare bankruptcy, it all started with medical bills. And then they went down from there. So I would, this is where the emergency fund comes in really handy. She also asked, by the way, Scott, what the department or title the person I asked for is that the concierge service you're talking about?
Right. So a lot of them call them concierge services. In each company does a little bit different. Or a case manager. If you've got an ongoing condition, your case manager will help you with that. But I would start with concierge service if they have a concierge service offered.
I like what Ryan said. Ryan is our manager, apparently. Thanks, Ryan. Don't forget to smash that up button for us. Thanks for doing it, because I always forget to say that, Ryan. So we owe Ryan something. We definitely do.
The other one, Joel, you were talking about the emergency fund, and that's the ultimate way to do it. But the other suggested simple way to find money is if you've got large deductibles, everybody gets, how many credit card offers do you get a year?
Yeah.
Take a credit card, take one. If you can get a $5,000 limit, get that and hide it in a drawer. Because you're right, the interest rates on that are obnoxious.
Yeah.
So you don't want to pay those.
Yeah.
But instead, here's a stat. We talked about mental health earlier. When you have serious health issues, you lose 70 to 75% of your cognitive reasoning. If you add financial challenges to that same situation, it doesn't get better. Let's just put it that way. So if you can mitigate that and take one of those issues off when you have serious health issues, why not do that? And it could simply be, I got a $5,000 line of credit, a credit card in my desk drawer that says, I don't want to use it. I want to go to my emergency fund first. I want to do all these other things. But instead of getting overly concerned and having my anxiety shoot through the roof, I know I've got an out if I need one.
Yeah, we used to, when I was a financial planner, we would use what we called the ice cream cone. We would start off with first year cash reserve was cash in the bank. Second was maybe CDs or very non-aggressive bonds like treasuries as a second tier. And then the scoop of ice cream on the top was access to credit.
Yeah.
And the big problem I'm seeing now, and we actually did a story on this just, I don't even think it's out yet. We recorded it live yesterday, Kristen Wong and I think it's going to be out tomorrow on Money with Friends. And that is a Barron story that reported that we're seeing consumer access to credit start to do what it did in 2007, 2008, where companies are loaning people less money and less access to credit. And the only thing I worry about is if the economy gets really bad, we'll see them pull that credit out right from underneath us.
Agreed.
You won't have it anymore. And that gives me a pit in the bottom of my stomach. But I love the idea of access to credit. And a lot of that is know yourself. There was a time of my life where that credit card, Scott, would have never stayed in that drawer. That would have been out, and I would have bought I would have invited you over, my friend, or better yet, I would have gone up to Traverse City because it's beautiful where you live. I would have gone there. I would have partied, and then next thing I know, it would have been bad. But for most of us, well, especially nerds like us hanging out here, having that available. Good.
A quick story along those lines, like an ATM card, credit card. The only time I went in and when I've gambled is when I used that card inside the casino.
Of course. Hey, we didn't talk about an important part, HSAs. We didn't talk at all about HSAs. HSA is a big thing with our community.
You've got to look to see what makes sense for you. But if you're considering or you're in a high deductible plan already, the things you'll lose are office visit copays and pharmacy copays. But if you're a financial planner like you're talking about and you want to stack the Benjamins, you only pay for things that you can't predict. So again, if you step back and you define who you are and get a health profile and know what you're going to have during the year and you can plan for that, don't pay an insurance company for a low deductible because they're just going to tack at administrative costs and margin on the top of it. Pay for as much as you can. And then if you can save money and Uncle Sam's going to give you a tax break on it, take it.
Yeah.
Take it and run with that. And when you build those funds up, we were talking about the emergency slush fund. Your healthcare emergency slush fund can become your HSA.
Yeah.
Or vice versa. Your HSA is your emergency slush fund. And here's the great thing about that. Over time, once you hit 59 and a half, you can spend that on whatever you want to spend it, like a 401k. So it's a very, very interesting vehicle to do. And then what you want to think about, and I apologize, I just touched my face and I just broke one of the CDC things.
I do it all the time.
Yeah.
I've done it, but I haven't been out of the basement in like 6 months. So,
well, it snowed up here, just to let you know. I think we covered that already. Well, anyway, an HSA, it can be a really good vehicle. And what I would suggest to a lot of people that have large claims get concerned about it and say, oh, I really need quote unquote better healthcare. Look at what your max costs are. The max amount you have to pay in the health plan before the health plan goes to 100%. Then look at your monthly premiums that you have to pay. That's guaranteed. Okay. So if you know you're going to blow through the maximum health costs and get to 100%, take the lowest premiums that you can get and take that plan.
Yeah.
It's all about doing the math when you pick an insurance plan. It's painful. No one wants to do it. But if you do the math, you can find out you may come out actually better on a net cost basis. Now you have to figure in cash flow, and that can become an issue. So that's where Katie, you were talking about earlier, I think it was Katie, how you talk to your doctor. Start talking to a doctor if you've got maybe a chronic condition and you're going to be on an HSA and you're going to be paying all this money up front. Doc, can you give me a payment plan? Can you help me out? Can we stretch this out? And I've got examples of book and people I've worked with that have done that and done very well. And then they'll even go back towards the end of the payment plan and say, Doc, if I paid you the rest of it up front, will you give me a discount? And I've gotten that. So, and you may get a no, but here's the deal. I had been in sales in part of my life. If you don't ask, you're not going to get it.
You have to ask.
You got to ask. And if they tell you no, you're no different than before you asked. So there's no harm in asking. Diplomatically.
That's right. Diplomatically is the key in everything. Susan, we're gonna do some cleanup here, guys. Give you a bunch of resources. Scott's already given you a bunch, but first of all, Susan wants to know if you've got an email list.
My email. When she says email list, is that she wants to know my email?
Send out facts, a newsletter, anything like that.
We do. So go to uncoveredhc.com, and we have a number of places where you can get our emails and our blasts, podcasts, information. And right now we've got a little COVID site, and what we are is basically a curator and aggregator of what's going on out there to try to help you have better experiences. So we try to find vendors and give you access to them. And what we've been able to do, a couple of them, is get basically programs that are only offered to employers and made them available to you guys if they make sense. And then we're just also about information, how you can do it all on your own. And so I'd encourage you to get on the site. I'd encourage you, if you've got great suggestions or done things differently and more successful than we have, we'd love to hear from you, and we'll fly your flag quickly up on our site and give you some airtime, because we don't have all the answers, and I'd love to have everybody helping me try to have us all become consumers and control healthcare.
I'm showing the free month up here. Remind people what the free month is for if they put in free month.
All right. So for free month, we have two programs. We have a telemedicine program that goes 6 months or 12 months. If you sign up now and use free month as a result of this program, we'll put an extra month for free on it. So you'll have a free month to trial it and then run there for either 6 months or 12 months.
Last thing, Scott's book, and you can see why we really enjoyed talking to Scott in December. You can hear my interview with him if you just go back through the archives to the beginning of December. Scott was definitely hit on the show like he was today. Healthcare is Making Me Sick. It was a fantastic read and a great resource for us. Scott, thanks a ton, man, for hanging out with us and talking about healthcare. It is just so, and by the way, thanks to everybody who hung out with us. I once again was so worried that we were going to get into some baloney political discussion, and we did not. And that makes me very happy because, as Scott has shown us, there's so much that we can do. I mean, don't get me wrong, go vote, right? If you want things different, go vote. However, there's so much you can do before that. I don't know. I felt really empowered talking to you, Scott. So thanks.
So, I mean, here's the bottom line: vote with your feet, vote with your pocketbook, and that's. We can complain all day long, but the thing that makes the difference and companies respond to is voting with your pocketbook and your feet. And then that has to happen in healthcare. And the exciting thing is it's starting to happen, and people like you, your people on the show are doing it. And that's so encouraging to me.
Yeah, really awesome. All right, guys, thanks. And we'll see you guys Friday back here with Dr. Dino Crosby. And obviously today on the podcast and Friday on the podcast. Bye-bye, guys.